Have you ever imagined waking up one day and seeing headlines about a new virus spreading again? After COVID-19, that fear feels familiar, and that's why names like Nipah virus quickly grab attention. But before fear takes over, it's important to slow down and understand what Nipah virus actually is and what it isn't. Because facts calm panic. Nipah virus isn't new. Scientists have known about it for more than 25 years. It didn't suddenly appear after COVID. It's been quietly monitored for decades. So the real question isn't, is Nipah scary? The real question is, does Nipah behave like a pandemic virus? To answer that, we need to understand where Nipah comes from, how it spreads, and how outbreaks have been handled in real life. Let's start at the beginning. Nipah virus was first identified in Malaysia in 1998 during an outbreak among pig farmers. Doctors noticed something unusual, severe brain inflammation appearing in clusters. Scientists traced the source to fruit bats, also known as flying foxes. These bats carry the virus naturally without getting very sick themselves. The virus jumped from bats to pigs and then from pigs to humans who worked closely with them. Later outbreaks in Bangladesh and India showed another route, fruit contaminated by bat saliva or urine. In some cases, Nipah also spreads from person to person, usually among family members or healthcare workers. This already tells us something important. Nipah spreads through close contact, not casual exposure. That difference matters because it limits how far and how fast the virus can travel. Now let's talk about symptoms and why Nipah gets so much attention. Early symptoms look ordinary: fever, headache, muscle pain, fatigue, nothing that screams rare virus at first. But in some patients, the virus progresses to encephalitis or inflammation of the brain. That's when the illness becomes dangerous. Across past outbreaks, reported fatality rates range from 40 to 75%. Those numbers are serious, and they're why Nipah is closely watched. However, high fatality does not automatically mean pandemic. A virus must also spread easily, and that's where Nipah is different. Unlike COVID-19, Nipah is not primarily airborne. It doesn't spread efficiently through brief contact or shared air. This means outbreaks tend to stay small, localized, and traceable. Every known outbreak so far has been contained using standard public health tools. So what happens when new cases appear today? When Nipah cases are suspected, patients are isolated quickly. Contacts are traced. Monitoring begins immediately. Healthcare workers use protective equipment to stop further transmission. There is currently no specific antiviral drug or approved vaccine for Nipah. Treatment focuses on supportive care. Despite that, outbreaks have still been controlled because speed and isolation matter more than advanced medicine alone. Countries affected in the past now have prepared response plans based on real experience. Surveillance systems today are stronger than they were before COVID. That reduces the chance of silent, uncontrolled spread. Now let's return to the big question. For a pandemic to happen, a virus must spread efficiently between people, often before symptoms appear. So far, Nipah has not shown this behavior. Scientists do watch for mutations because viruses can change. That's why Nipah is on global watch lists, not because panic is expected, but because preparedness is smart. Research into vaccines and treatments is ongoing, even without a global crisis. So is Nipah the next COVID-19? Based on current evidence, no. But staying informed helps ensure it stays that way. Which brings us to prevention. What actually helps? Avoid direct contact with bats or sick animals. Avoid eating raw or damaged fruit that could be contaminated. Practice good hygiene. Hand washing still matters. Healthcare workers should follow infection control protocols carefully. If someone becomes sick after high-risk exposure, early medical care makes a difference. Most people worldwide will never encounter Nipah virus directly. Understanding risk correctly prevents unnecessary fear, and unnecessary fear spreads faster than any virus. Prepared systems, informed communities, and calm responses are the real defenses. Knowledge doesn't make us anxious, it gives us control. So instead of asking, what's the next pandemic, a better question is, are we better prepared? And today, the answer is yes. Thanks for watching. What are your thoughts about it? Share with us in the comments section below. Subscribe to Cartoon Boy for interesting stuff. Don't forget to turn on post notification for update.